subacromial pain syndrome, SAPS. This particular thing is an APC masterclass for all the physiotherapists who are dreaming of moving to Australia, New Zealand, UK, and Gulf countries. Also, please do not leave this webinar in the middle, because at the end, you will be getting a participation certificate from Team Academically and the entire in-depth pathway brochure. How can you move to all these countries in a detailed way? Also, the people who want to enroll with Academically can talk in the end when we take up the Q&A session. Our members or our team members from the sales team are also there in this webinar. They will be connecting with you right after the webinar. Okay, so let's get started. First of all, as a member of Team Academically, I want to introduce our Academically team in front of you. So all the global physiotherapists out here, let's first talk about our Academically team. So we are headquartered in Australia, Sydney. Academically, as you all know, is an edtech, and you would have heard about it. You would have seen Academically at a lot of places in the social media and also in the print media if you are from Academically. And we are basically an edtech, guys, okay? The only vision, the only aim of ours is to help healthcare professionals excel in their lives, in their careers. Because as you all know, we healthcare professionals do not have placement opportunities, unlike the technical people. So this was one vision, this was one reason why Academically was created. It was established by Dr. Akram. You would have heard about him a lot. You would have seen his videos and reels and a lot of social media content. So sir is an educationist and a healthcare professional, and he's got years of experience in different countries, namely India, Malaysia, and Australia. So basically, we at Team Academically will offer you support, not only for the physiotherapist. If you have any relatives or your friends who are doctors, dentists, nurses, pharmacists, we offer support to all the wings of healthcare professionals who wish to upscale their careers by migrating to Australia or the other countries which was mentioned over there. So we're actually setting new standards by providing preparation courses for the most advanced global healthcare exam. We offer you guidance, resources, and definitely an unwavering support. You're meeting two of our team members today. That's me and Dr. Prachi. She'll be taking up your APC Masterclass. But before that, I would like to introduce our founder and CEO. As you know, Dr. Akram is an esteemed clinical pharmacist. He has been a distinguished professor and an accomplished research scientist with an impressive 15 years of experience in all the 3 countries mentioned on your screen. With a determination to help healthcare professionals across the globe, his dream of moving abroad, with his dream, he started Academically. So basically, he got a scholarship. You were watching his episode, his life journey on Brands of Tomorrow, season 3, which was being streamed right before we started off with the webinar. And was actually, his story. It's very inspiring for me, you, and all of us. And he thought that if I can move on the basis of a scholarship, why not should I create awareness in front of all the healthcare professionals that you can also move abroad and flourish in your career, which is probably not getting that much of enhancement in your own country. Through this initiative, he provides education and training for pharmacists, medical doctors, dentists, nurses, lab technicians, physiotherapists, or various medical registrations exams so that you can move to your dream country. We've also started with a study abroad vertical, guys, to support the career advancement of healthcare professionals. We have launched a study abroad program for those wishing to pursue higher education abroad. So if you want to do MTT from Australia or any other country across the globe, or MHA or any non-clinical part, Academically Study Abroad EduCafe is right here to help you. This is our academic head, Dr. Snigdha. So she is the academic head for medical courses. Ma'am has completed her MBBS and MD from CMC Ludhiana. She's got over 10 years of extensive experience with a wealth of experience. She is a USMLE qualified doctor. And so all our content is being created with the help of Dr. Snigdha, with our esteemed faculties. You will be meeting one of her, you have already met actually, and also definitely our entire content team. Our only vision, our only mission is to help you clear the exam for which you are preparing. Now, introducing our faculties to all of you all, we have Dr. Kushangi, Dr. Mansi, Dr. Dilpreet, and right in front of you, Dr. Prachi Deshbhratar. Dr. Prachi has done her BPT MPT from India. She qualified the APC written exam, clinical exams, and today she's practicing as a registered physiotherapist in Melbourne. Ma'am is an AHPRA registered physiotherapist, and as I told you, she has undergone the similar journey as you have. Your APC Masterclass will be conducted by her, And after she finishes up, if you have any questions or queries, you can just put that up on the chat box, or you will also be given an opportunity to switch on your mic and talk to us after the APC Masterclass ends. So over to you, Dr. Prachi. You can continue with the webinar.
Thank you so much, Sonal. Um, Good afternoon, everyone. I hope everyone is doing well. So in today's session, we are going to talk about this topic is subacromial impingement syndrome. But before that, just giving you a bit overview of what sort of question been asked in APC. As Sonal ma'am has already said, there will be questions from musculoskeleton sciences, then there will be neurology, and then there will be cardiology. So those questions will be asked. Each question will have a case scenario. So you will have a case scenario like a patient of 65-year-old male had a pain in the bilateral knee or right knee since few months. Then he has this special test positive. Then then there will be a question, what could be the diagnosis, and then there will be 4 options being given. Out of 4 you have to select one. So the same case scenario will have 4 different questions. So they might ask in the second question, what will be the special test, or what will be the muscle involvement, or what will be the treatment plan, and then there will be option given. So every topic what we have to read, we have to think about how the case scenario can come from that particular topic, and what all questions can be raised from that particular topic. So in today's session, we are going to see a very small topic, which is subacromial impingement syndrome. But it is a very important topic because it is very common. As you know, in Australia, we have sports as one of the important things in school, uni, and each and every person does like to play sport. And during the sport or during any activities, there are many times where the patient get injury in the shoulder. So one of the commonest one is subacromial impingement syndrome, which is also called as subacromial pain syndrome. So the next slide. So in earlier days, it used to be thought that the subacromial impingement is a diagnosis, but now it is not a diagnosis itself, but it is a sort of symptoms which we have to understand, and based on the symptoms, we have to come up to certain information that what part might be getting injured or have pathology, and what we can do to treat that. So when we check the anatomy, so this is the AP view of the shoulder, and you can see few ligaments around the shoulder. So the first one is coracoclavicular ligament, which is at the clavicle with the coracoid process. Then we have acromioclavicular ligament joining the clavicle and the acromion. Then we have coracohumeral ligament. And then we have the transverse ligament within the humerus, and the 3 ligament, which is superior, middle, and inferior glenohumeral ligament, which will be on the anterior and the inferior side of the shoulder. So these are the ligaments which holds the shoulder joint and supports the shoulder joint as a passive restraint. So what is passive restraint? Passive restraint is the structures which holds the joint to the shoulder without any muscular involvement. That is called passive restraint. Then we have the muscles on the right side. The diagram which has been shown is the posterior anterior. That means from the posterior to anterior view. So you can see various muscles here. So the first muscle of the rotator cuff is subscapularis, which will be on the front. The other one is supraspinatus, infraspinatus, and teres minor, which is the second part of the rotator cuff. And then we have again the capsule, which holds the joint. Here it is triceps, which is not relevant to our study today. So these are the active restraint. So these muscle holds the joint and does not let the shoulder subluxate. So these two structures are important. during the movement of the shoulder joint. There are other structures as well, but relevant to our condition, which is impingement, these structures are important. So you can see from here, there is a space between the humeral head and the coracoacromial ligament. There is a space. That space gets compromised, or you can say when the shoulder joint we move, this space gets compressed, and that's how we get pain. So we are going to see in detail what happens actually when we move the shoulder or when we move the arm, and this what happens to this space. The next slide. Okay. So shoulder impingement, as I have said, it is not a diagnosis, it is just a sign. And then based on the sign, we have to decide what structure is getting involved and what we can do to treat the condition. So in APC, the question being asked that the patient is having pain in the shoulder region in anterior portion. Sometime they ask the question, the patient is having pain in the posterior side of the shoulder. So we have to understand, okay, anterior structure is getting compromised. What could be the reason? Which structure it must be? Or if it is on the posterior side, what structure is getting compromised? There will be, in the case scenario, you will see 4 options. For example, there will be some bursa or some ligament or some muscles being given, and we have to diagnose which muscle, which ligament is being injured if the pain is at the anterior side. If the question is being asked in the APC that the patient is having pain while lifting the arm above the shoulder, and the patient is having pain around the tip of the shoulder. So then we have to understand, okay, which structure is here, which can lead to compression or pain around the shoulder. So these sort of questions being asked in APC. So the next point is irritation to the affected structure, presentation of the symptoms. So in shoulder impingement, as you can see here, we have coracoacromial arch, this starting from the coracoid to the acromion. So this arch, and we have the shoulder here. So the structure below that, either it is the muscle or bursa, any structures, when it get compressed because of either poor posture or because of some scapula changes, maybe because of anatomical changes, maybe because of postural changes, maybe because of kinematics, these structures get compromised or compressed when you lift the arm in abduction. So the same slide, yeah, in abduction. So you can see the 2 common sites of impingement is subacromial and subcoracoid. So in APC, they had asked question between subacromial, what do you see? And subcoracoid, what do you see? So in subacromial, so the name suggests it is below any structure which get compressed below the acromion, it is called subacromion. Any structure which get compressed below the coracoid, that is subcoracoid impingement. So the structure in the first one will be bursa or supraspinatus muscle or the other muscles around the shoulder, that is the rotator cuff muscle, that might get compromised. In subcoracoid, the structure around the below the coracoid process that can get compromised. So what will the patient symptoms? That I'm moving the arm. Once I try to move the arm, I am not able to move because there is some pain around the shoulder. The pain will be here around the tip of the shoulder in subacromion. While in subcoracoid, the patient will say that when I try to do adduction and internal rotation, I will have pain around the front of the shoulder. So in APC exam, there was a question that the patient is not able, the patient is an athlete, 20 years old male, not able to play forehand technique, which is flexion, adduction, and internal rotation while hitting the racket during the tennis play. So tennis game. So the movement which we do during we have to hit the ball. So flexion, adduction, and internal rotation. So in that case, the patient will have pain in the front. So that answer will be subcoracoid impingement. If in the exam, if the question being asked, the patient is having pain while lifting the arm above shoulder or during abduction, then the answer will be subacromion impingement. So they give answers, or they ask question, either identify the diagnosis based on the presentation, or they will give the diagnosis and then they will ask what is the presentation. So they can give both the case scenarios. Now let's talk about the next slide. Okay, so pathology wise, again, you have different structures of the scapula and the acromion. So subacromion impingement, we have different classification. So in APC exam, they had asked questions on the classification, that if it is a type 1 classification, what will be the treatment? If it is type 2 classification, what will be the treatment? So the classification also depends on the structure. So this is where the what you call the actual bony structure involved. So if the scapula is, or the acromion process is more flat, the space is bit less, not that less. But when you see the scapula, the acromion is curved here, the structure between the here, the acromion and the clavicular space will be, coracoid and the clavicular space is very narrow. When the scapula or the acromion is hooked, you will see the space is very less. So from first, you can see the space is bit more. Second, the space is bit narrow. And the third, you can see the space is very narrowed. So in such cases, this is called hooked process, hooked acromion process. This is called curved, and this is called flat. So in all the three structures of the scapula, the third one is the most common where, or the most what you call, where you will have the maximum compression. So in APC, again, the question being asked, which scapula has more prominent to have compression? So hooked acromion is the answer for that. If they say which scapula position, or which scapula has the less chances of compression, so that is the type 1. So either they can ask type 1 to type 3, or they can ask which one is hooked, which one is flat, and what is the significance. So these are sort of questions can be asked in either way. Then there are other classification. Apart from the NIRS classification, we have external impingement and internal impingement. So external impingement, the name suggests there will be some structural changes outside the real joint. With the structural changes outside the joint. So that has been again classified into primary external, which is some structural changes like either thickening of bursa or some muscle swelling or anything. The secondary external impingement will be scapulothoracic kinematics. That means the scapula position, because of the muscle or because of the posture, has been changed. So that is called the secondary external impingement. So these impingement is not within the joint, it is outside the joint. The second classification is internal impingement. So in internal impingement, consider this is the glenoid fossa and this is the head. So the impingement occurs within the joint, either anterior or posterior. So the impingement which occurs within the joint is called as internal impingement. The impingement occurs outside of the joint, maybe because of some structural changes, maybe because of some muscle, that is called external impingement. So in APC, they had asked question about what is external impingement, example, what is internal impingement, example. So in example, they have given like options of example and what is the correct option for internal impingement, what is the correct option for external impingement. So in internal impingement, you will see The patient will be either doing a throwing activities, which is abduction and external rotation, like throwing a ball. And when you do abduction and external rotation, the patient will say pain around the posterior superior surface of the shoulder joint. And the second one is overhead athlete, where the patient will try to throw the ball and then there will be pain around the anterior and superior aspect of the shoulder joint. So in APC, the question being asked that a thrower, the patient is complaining of pain around the shoulder in the posterior superior aspect, which sort of impingement it is. So yes, if the patient is complaining of pain, abduction, external rotation, it is internal impingement, especially with the throwing activities. If the patient is complaining of pain while doing overhead, could be again anterior superior impingement, could be internal impingement. If the patient is saying that, okay, I'm just getting pain while doing the abduction of the shoulder, that could be external impingement. So these are the questions being asked so far in the APC. Next slide. Okay. So the clinical presentation. So now we know if case comes to you or in the exam, if such a question comes to you, so now you know there are external impingement and then there are internal impingement. Internal impingement usually occurs because there is a structural change within the joint that is there. External impingement can be because of maybe because of poor posture, poor kinematics, poor structure of the scapula, or some muscle weakness. So these are external impingement. So now we have to test. What test will confirm that these are the impingement? So the first one is the painful arc. So in this diagram, you can see the patient when they abduct the shoulder, you will have no pain till 60 degree, but from 60 to 90, the patient will complain of pain. Again, from 90 to 120 degree, the patient might have pain, but beyond 120 degree of abduction, there will be no pain. So if the case comes to you that the patient has pain from 60 to 120 degree, what is the diagnosis? Then it is painful arc syndrome. The patient will be almost around 40 years of age, in the middle age, and have persistent pain without any known preceding trauma. So the case comes in APC is the patient comes to you around 40 years of old, complaining of pain while lifting the arm from 60 to 120 degree. What could be the pathology? The patient gives no history of trauma, no history of fall, no history of injury. He just started getting this pain gradually, and now the patient is having too much of pain, unable to lift the arm. So this symptoms says that it could be painful arc syndrome. So this was one of the APC question, that which degree the painful arc syndrome starts, and what was the patient's symptoms. So the third point here is the symptoms may be acute or chronic. Most often it is gradual degenerative condition that causes impingement. So what exactly happens is when you lift the arm up, so consider this is the shoulder joint, and when you are lifting the arm up, so as I mentioned, uh, between the shoulder, between the head and between the acromion, there is a space. So this space is there where the bursa and the muscles rely or lie. So when they move, when the shoulder moves, if the space becomes narrow, the head tries to compress the bursa and the muscle. So when they compress, the patient will complain of pain. So compression of those soft tissue while moving the arm is called subacromial impingement. The next question. The next question. Okay. Sorry, the next slide. Then comes is the Hawkins-Kennedy test. Then we have painful arc, and then we have Hawkins-Kennedy Neer's impingement. So we have to know what is Hawkins-Kennedy, painful arc, and then Neer's impingement. So these three tests are very important to understand the subacromial impingement. Next slide. Yeah, the next slide. Uh, are you there, Sonal? Can you change the slide? Yeah. Okay. So the special test, we have different special test as well. So the special test we have, there are n number of special tests. So in exam, they will give you the options of various special tests, but based on what is the patient's presentation, we have to find out. So consider AC joint. So that joint special test is Paxinos test, which we don't have to do if it is subacromial impingement. We have scapular test, which we don't have to do. The scapular test is done when the scapula is unstable or you want to find out whether the scapula muscles are weak. So that is the test for that. So the important test for this topic is impingement, which is NIRS and Hawkins-Kennedy. Instability test to be done when you think that the shoulder joint is unstable, and then you have to just do load and shift and some apprehension test. Inferior, if the shoulder joint has inferior instability, then you do inferior instability like sulcus sign. Slap lesion, if we have labral lesion, then we do Bankart, Oberon, or crank test. So for this topic, we don't need to do all these tests. Specific palpation, yes, we do. And neural tension to be done if you suspect that there is any nerve involvement, like if there is any median nerve, radial nerve, ulnar nerve involvement, then we do some ULTT test. But for this topic, we don't have to do these tests. So for this topic, the only test important is painful arc, NIRS, and Hawkins-Kennedy. Can you change the slide? Next slide, please. Yeah, thank you. So in NIRS test, the physio will be behind the patient and the patient will be in sitting position. What we have to do is lift the arm of the patient passively and do the rotation. So when you lift and do the rotation, like lifting and do the rotation, suddenly the patient will have pain around the shoulder. So if this contest is positive, that means there is a impingement. What this test do is, in this test, you are going to lift the arm where consider the shoulder. You are lifting the arm, so you are compressing the space plus you are rotating. So you are compressing plus you are rotating. So it will compress the bursa, it will compress the rotator cuff muscle. And if they are positive, then this patient will complain of pain. Next test. Yeah. Then the Hawkins-Kennedy is also similar test where you are going to again compress and rotate. So the patient will be in sitting position. The therapist will be in standing. You are going to support the shoulder at 90 degree and then suddenly you are going to do the internal rotation. So when you are going to do internal rotation, so in abduction, you have already compressed or you have narrowed the space, and then you are going to do the internal rotation, like abduction and internal rotation. So in this, abduction already compresses the space and internal rotation will also compress the space. So the patient will complain of pain around the anterior and superior surface. So if the patient says, yes, my pain is there and it has aggravated, then this test is positive. The next slide. Investigation in APC, they would like to know what the physio know about the condition. So their goal is whether the physio is able to understand or diagnose the condition of the patient. Along with that, whether the patient can, whether the physio can diagnose the proper condition if there is anything else or if there is any other injury. So consider if you have a patient and you think that the patient require further investigation. So as a physio, you should be understanding that, okay, I need to refer this patient back to the GP for the X-ray or for some MRI. So how we can do that? Unless and until we know the diagnosis that, okay, this might have something else as well. So in those conditions, we have to do certain X-rays just to consider if there is other abnormality. High resolution of ultrasound is needed if we suspect that there could be tendon involved or rotator cuff muscle involved. So in APC exam, they had asked question that for the or such condition, which diagnostic tool you will opt for, or which investigation is best to rule out these condition or to understand this condition. So if you do for tendon, it should be ultrasound. If you want to do some soft tissue checking, such as ligament tear or something, then yes, MRI can be done. In arthroscopy, we can just see if there is any other issues, and with the same time there could be some treatment. So arthroscopy is considered as an investigation plus the treatment process. MRI and ultrasound is just a investigation, while plain X-ray is just to rule out if there is any fracture you suspect or any other thing. So investigation part, we don't have to run the investigation, but we should know why the investigation is to be done. If you suspect any other abnormality, any fracture, or if you want to rule out certain things, then you can forward it to the GP. So the APC, they want to know the physio understands the condition. The physio can run the special test, can come up to certain diagnosis, and if needed, can refer the patient back for the investigation. So that is their main motto of understanding the investigation. Next slide. So outcome measure. So outcome measure, as a physio, we have to do one or two outcome measure uh, to understand what is the patient's condition on day one and how the patient progresses on day after maybe 2 weeks or 3 weeks or 6 weeks. So for example, patient comes to you and then you have done the assessment, you come up with the diagnosis, you have done the treatment, but you don't know whether the patient has improved or not. So what we have to do is, on day one, we have to do one outcome measure at least, either SPADI or DASH or any shoulder disability questionnaire. So you have to do it that on day one. It is like a tool. We have to fill the questions and then we have to do the scoring. So for example, on the day one, I got a score of 10% out of 100%. So the patient's score is 10%. But after 6 weeks of treatment, we need to know how the patient stands. So it will give you an idea whether your treatment is effective or not. So that's why after 3 weeks or 6 weeks, you are going to do the outcome measure again. So in exam, APC, they want to know whether the physio can apply a outcome measure, whether the physio knows the outcome measure and which outcome measure to apply. So for example, as I have mentioned here, SPADI and shoulder disability questionnaire and DASH questionnaire. So we need to know the component, how to apply it, and how to reapply while we're doing the outcome assessment. So in APC, they had asked question like, the patient has pain in the shoulder, which outcome measure the physio should do? They have given DASH, they had given KOOS, they have given oswestry scale. So out of that, we should be knowing DASH is for shoulder, KOOS is for knee, oswestry is for low back pain. So outcome measure, we need to know in detail. So these are the questions being asked in APC in terms of outcome measure. Next slide. Okay, so the treatment part is, if the patient is having pain and you know it is external or internal, so the first thing you have to tell the patient is, try to avoid the position or try to avoid the movement of that particular or to avoid that action which increases the pain. If the patient has pain while lifting or abducting, avoid that. If the patient has pain while abduction and external rotation, avoid that. If the patient has adduction and internal rotation, avoid that. So that is the first thing you have to tell. If the patient has pain, then we have to do certain rest or peace and love protocol, which is rest, icing, and some pain meds which the GP will give. Some corrections, like we have to tell the patient either to do the ergonomic advice, or we can give some postural correction, and then we can give some exercises, and based on that we will see how the patient works. But in terms of treatment, we have conservative treatment and surgical treatment. So conservative means we are just going to rely on our pain management, GP's pain management, exercises, ergonomic, and lifestyle modification. If things does not work out, if the patient's pain is still persist, or if it is worst, then there could be a surgical treatment, which the patient has to opt. So surgical treatment means, the as I mentioned, there will be a compression of the bursa between the space. So if there is a compression, so you have to do either bursectomy or some repair, or if there is compression of the rotator cuff, then you have to try to decompress that area. Or if the acromion process, which was hooked and curved and all, so those acromion we have to just do some acromion plasty, so that the space between the acromion and the coracoid is bit bigger. So these are the surgical process. But in APC, for physio, they do not ask much question on the surgical part, because that is not our scope of practice. So they are going to ask more in terms of treatment, in terms of diagnosis, in terms of symptoms, and in terms of investigation. Next slide. Next slide. Yeah, thank you. So this is our last slide. Um, we have some treatment protocol. We have the RICE, which is the rest, icing, elevation. Then we have some postural correction, some mobility exercises we have to give, like just move your arm or spine, so that there should not be pain. Manual therapy,
Manual
if
therapy,
the shoulder is too stiff, then they can give some mobilization or Mulligan's technique. Strengthening exercises for the weakened muscle. Neuromuscular control exercises, again for the weakened muscle and to get the muscle proper firing. Stretching exercises if the capsule is tight, if the muscles are tight, if the upper trapezius is tight. Then we have again manual techniques. Taping techniques is just to give the scapula and the shoulder a correct position, so that the compression to be avoided. Acupuncture is like a dry needle, so that can also be given. Electrical stimulation like TENS and IFT can be given. Ultrasound if there is any pinpoint pain. Low level laser therapy has also been given these days. Steroid injection is usually given by the GP. If there is no physiotherapy related effect, then the steroid injections can be given. And the last one is high energy extracorporeal shockwave therapy, which is one of the evidence based. So these are the physiotherapy protocol which we have to give, and that's it for the physio. Thank you.
thank you. Okay,
So
thank you so much,
like
Prachi
over
ma'am.
time. Yeah.
Yeah, guys, just one change. So due to some technical errors, we are just putting a pause on this particular webinar. Okay, you all can just leave the meeting and rejoin on this particular link quickly, guys. Just if you could just leave the meeting and quickly join on this particular link again, and then we'll be taking up your questions. Okay.
in Australia might be different than what we have studied as an Indian students. So I wanted to ask that how it will be difficult or it will be easy if we pursue APC exam because everyone is new to clinical that is going to happen.
So I'll just answer this one. Earlier, it used to be, as I mentioned, clinical exam, but earlier you just have to come physically here. But now they are taking some online exam. The
Yeah, the
discussion one,
capability
clinical
assessment,
discussion
ma'am.
one. So where they will just test your clinical knowledge. Once they feel that as per their criteria, you clear that, then they are going to invite you for that 1 day workshop. In terms of your Indian knowledge, as you mentioned, and Australian, the thing is you go by books. That's it. Do not follow what you are doing there or here. You go by books. If in the books, especially the books which they have referred, if you follow them, that's it. That's what they want, word by word, or what you call the special test by special test, or treatment by treatment. So whatever is being given in the book, you are following that. That's it. That's what they are expecting from the clinician.
Okay, thank you, ma'am. Sir.
Thank you, Maitri. Next, let's move on to Dr. Sara Afzal. Dr. Sara, your question, please. Yes, Dr. Sara, you can ask your question. You've raised your hand. Okay. Let's move on to Dr. Sanat Patel. Dr. Sanat, go
Excuse
ahead
me,
with the question.
can you
Okay.
tell me?
All right. Yeah, I can hear you. Yes.
Yeah, actually, I am planning to move to Australia with my spouse. He is a practicing lawyer of High Court, and I am a practicing physiotherapist as well as a lecturer. And now I want to move to Australia. What is the best pathway for both of us to move together?
Okay.
Hello.
Sir will answer.
So,
Yes, sir.
Sound, you can explain physio pathway, and
Yes.
for lawyer, we can't comment basically. We
Hmm.
only deal with the healthcare professionals only.
Yes, sir. Correct.
No,
Yes,
no.
sir.
Actually, I want to go with my spouse. I'm not
He
talking
can
about
go
the
along with
licensing
you.
from the
पर
for
हमें
the
नहीं पता
lawyers.
कि वो कैसे
But
प्रैक्टिस वहाँ कर पाएंगे. He can
Huh.
go along with you.
Yes. So, Dr. Sara, what Dr. Akram is
he gonna
wanting to
be my
say is,
dependent on that time.
no, no, let me just finish up with your question because you have two questions intermingled with each other, Dr. Sara. Okay. Let's break it
Yeah.
down into two. Number one, we can't comment on the lawyers, what kind of pathway they follow because we are in healthcare ed tech. We only deal with that. Coming down to your second question, yes, if you are going as a registered physio over there, you can take your spouse definitely along with you. Okay. What are his job opportunities or something like that as a lawyer over there in Australia is something we could not comment on. Coming back to your APC pathway, yes. So if you talk about the entire APC pathway, it's a completely remote exam, first of all, Dr. Sara. You sit at your home and you give the examination. Number one process is the document verification. So whatever you have to be a registered physiotherapist in your country. So whatever documents are required, you have to upload those documents and get the interim certificate. On the basis of that interim certificate, you will book your written exam from your house. Okay. You will take a remote written exam, which will be done on 1 day in 2 shifts, in the morning and in the evening. Once you qualify your written exam, you will be getting the exam results within 6 weeks of the date of your examination. If you pass the written exam, you will have to sit for the new process, which is called as capability assessment. So earlier, clinical exam was happening, but now they're not conducting clinical examination. As Prachi ma'am told, you do not have to move to Melbourne to sit for the clinical exam. There's just a small Viva session, which is an open book exam. They'll be giving you 3 short case, 1 long case, open Viva for 1.5 hours. If you pass that, then you'll have to go for a clinical workshop in Melbourne. And after that workshop, you will be getting your certificate. After that, you become a registered physiotherapist in Australia. You can apply for jobs, you can go on your visa, and you can take your spouse with you. Okay.
Okay. Okay. What is the duration of that process? The whole process, if I want to register myself in Australia.
Okay. So number one, for document verification, it totally depends upon which kind of are the documents all ready or not. If the documents are ready, your document verification will just take 10 to 15 days, maximum 1 month. Okay, not more than that. After that, you book your exam. You get the results within 4 to 6 weeks. After you're getting the result, you can book the Viva examination. Now, for the Viva results, you get within 14 days. Okay. And after 14 days, you go to Melbourne for the workshop and you get your registration. Like you get your final certificate and then you can register with AHPRA, which doesn't take a lot of time if you're finished up with the process.
Okay, in the prior session, you have mentioned that you also help in study-based immigration in Australia. Like
Yes.
if I want to apply for a MPT in Australia, can I bring my spouse with me in that scenario?
Okay. So for that, there's a separate team, the EduCafe team. They'll be connecting with you right after the webinar. Whatever queries you have regarding that, you can ask them. Okay. Like in
Okay,
detail,
yeah,
they'll be
sure.
giving you an online pre-video consultation for 1 hour.
And for this examination, do we have to pass an PT or IELTS examination?
Yes. Yes, you have to pass the PT examination. PT, IELTS, anything. PT is usually easy. You can go ahead with PT.
And you can also assist me for that purpose?
Yes, we can. We assist you for the entire process, like PT, document verification, written exam, all of that.
Okay, what are the charges for all this process?
As I told you, our counselors will be connecting with you after the webinar. You can talk to them freely about everything in detail. Okay, because others are waiting.
Okay, thank you so much.
Thank you so much.
Can I that meeting?
We can align it by tomorrow, Dr. Sarah.
Yeah. Yes. It will get Dr. Sara, you'll be getting the certificate. Okay. So just wait.
Okay, okay. Thank you.
Oh, thank you. Next, Dr. Shajil, you can ask a question. Dr. Shajil.
Hi, ma'am.
Hi.
I want to ask the study material you have provided is sufficient for writing as well as for Viva, or we have to study more?
Okay, so basically, as this is the first time the capability assessment is going on, Dr. Shajil. Okay, so whatever information is been given from the APC website is what we know. No person has taken up the examination yet, the capability assessment. Okay, so so if you talk about the written exam, yes, you can see our success rate. You can see how many students have passed through our, and you've also seen the kind of PPT and the study material. It was just presented right in front of you, right, Dr. Shajil? One of our faculty was there. So this is the way classes will be held for you. Okay.
Okay, okay.
Regarding the Viva examination, well, Viva examination is also a clinical scenario based examination. So if you
So
prepare
what,
well for your written exam, your Viva, I don't think so would be a bit difficult.
so what do you think? Which pathway is more easy to go to Australia? Is APE pathway or via UK and then New Zealand or any other country which is more benefit for physiotherapy?
Okay. So Dr. Shajil, if you talk about the HCPC pathway, you'll have to work for 2 years in New Zealand and only then you can get your license transferred in Australia. But if you go through the APC pathway, you can do it at your own convenience, your own passing rate. So I think if you want to go faster, APC is the best one for you.
And I also want to add up one thing.
Yes,
These
ma'am.
days, they are not giving the visa, the completion certificate. So when you apply for the visa, you won't be eligible for that. So APC has made clear that they are not going to give their final completion
Hmm.
of AHPRA registration APC for the visa purpose.
Okay,
Okay.
thank you. And last one is why you don't have any course or any supervision for Viva because it's the first time they are conducting Viva.
So Dr. Shajil, until and unless you finish up with the written exam, only then you move on to the Viva process. And it's just
Yes.
been 1 month that the things have been. So it would be very easy for anybody to comment on something which has not yet been conducted. But in order to prepare a content or something, you need to first know about the details of the examination and then launch a course with a proper research. Is it not so?
Okay.
Yeah, that's the reason. Thank you. Next, let's move on to Dr. Haniksa Patel.
Hello, ma'am.
Hello.
I want to ask that there are some cupping therapy, dry needling, and tapping techniques are practicing in Australia. Should I have to do this workshop in
Okay, Dr.
India?
Prachi can answer probably.
Yeah, Haniksa, at this stage, don't focus on that. As I mentioned, go book by book. If you want to clear your written exam, just take one step at a time because all those things you can practice once you are here or just because they are just a day workshop. So for now, just focus on your written, and the written exam is based on what we have studied as a graduate level. So cupping technique, the dry needling and other manipulation or mobilization, they do not expect you to answer. Plus in written exam, they are not going to, vary much, because in written exam, you're not going to tell which cupping technique you are going to use. So not for now. Once you clear the exam, once you complete your final certification and you become a physio, then you can try and uplift your course, because you don't know whether you will be in musk practicing physio or neuro, or you will be in hospital, or you will be in aged care. So based on the requirement, you can uplift your clinical skills.
Okay, thank you so much.
Thank you, Anixa. Next, let's move on to Falak. Falak Masood, please ask your question. Falak, your question, please.
Hello, I want to ask that I am planning to move to UK after my degree, most probably, and I want to know the procedure or anything you guys can guide me.
Yes. So, Falak, very simple. For UK, you need to finish up with your HCPC registration. Now, what's that? In short, I'll explain. Healthcare Professions Council is HCPC. So, the way in Australia, APC is the council which conducts the workshops and the licensure examinations for physiotherapists in Australia. In the similar way, in UK, you have HCPC. For HCPC, you do not need to sit for any examination. It's a registration process. Okay. So in HCPC, there are 3 steps. Number 1, your English has to be proper. That means your IELTS band 7 is required. Okay. And secondly, your documentation should be very good. You should have at least 1 or 2 years of experience, because there's a CIF form, course information form, which will be filled by your college or university. Okay. And then after that, you go ahead with the entire process. So it's a basic registration. You collect your documents, give it to them. They will scrutinize it. After they scrutinize it and find it proper, then they will give you the link for getting registered in the HCPC Council. So once you're registered with HCPC, after that you can practice as a licensed physiotherapist in UK. We at Academically provide you guidance for the entire registration process, and you don't have to actually do anything. You just give the documents to the team and they'll get your registration done. Okay.
Okay, what would be the charges and everything?
So the counselors will be connecting with you after the webinar. You can tell them about your experience and documentation and all that, and they'll tell you the charges. Okay.
Okay, thank you.
Thank you. Let's move on to Keshvi Yadav. Keshvi, your question. Keshvi Yadav, your question, please. Okay. Next is Misbah. Misbah, your question, please. Misbah.
Good afternoon. I am Isma. I am fresh graduate. Am I audible?
Yes.
Hello.
Hello. Yes, Misbah, you're audible.
I am
Go ahead.
fresh graduate. I am fresh graduate. Should I go for internships or any other things like go for masters? Please guide.
Okay. Dr. Prachi, can you just guide her on
Yeah,
this?
sure. So, Ms. Ba, as you said, you are just recently graduated. Congratulations on that. I would recommend you to, go for the APC. That will be easy. If you clear the exam, maybe in 6 months you will get the certificate and you can straight away practice. But if you go for masters, then make sure that the course which you are opting for is giving you the final certificate, because some of the university, they do not give the final AHPRA registration even if you do the masters. So opt for only university which can help you in visa. Otherwise, if after completion of the masters, if you're not eligible to apply for the visa, then entire course and the money will be wasted. Plus, as Dr. Akram has mentioned, the course fees will be too expensive. Along with that, your living expenses and the food and all that stuff. 2 years or 3 years of course. So consider that what mental capacity or physical capacity you are in, and based on that, you can take the decision. But from my point of view, I would go for exam. If I could clear the exam in 6 months, like entire process, if I can clear in 6 months of time, then why to, waste more time into doing the same thing?
Yes. So
Thank
thank you
you.
so
I
much,
got it.
Prachi ma'am. Thank you, Ms. Ba. Next question is from Hamza. Hamza, your question? Hamza, your question, please.
Yes, ma'am. I want to ask about that. I am doing third year from Must University in Multan, Pakistan. But
Mm-hmm.
my university is not serious in practical.
Mm-hmm.
Uh, I am very worrying about my practical life that it will affect my future. So question is my please guide me what can I do to practice my will become good in future. Please I am very serious in practical but my HOD not responding me. Even they the university is private, they do not send us in any practical hospital there which we observe. Please guide.
Okay. Okay. Dr. Prachi, what kind of practices can he do if the university is not providing any proper clinical guidance to him?
Okay, so Hamza, you are in third year, so you still have 1 year time. So once you go into your fourth year, you finish your uni first. During the internship period, either it might be 6 months or a year of internship. I'm not sure how many months of internship you have. So once you are in the internship, yes, you will get to know, you can practice during that time, during the internship. And during the internship you start your studies so that you can work in the evening with some clinic or some hospital as a, just in under as an observership. So you can work there, try to get to all the observership like cardio, neuro, musk in all the different fields, so that by the end of 6 months or a year, once your internship finishes, you have a bit of knowledge and start reading the books. If you want to clear the exam, then whatever is been given as per the APC resources, whatever the book's name or the links they have given, they expect that at least the clinician should read or understand from that. So go and read the books which has been given by the APC booklet.
Okay. Thank you, Prachi ma'am, for the answer. I hope, Hamza, you've got your answer. Let's move
Uh,
on.
yes,
Huh.
yes. Very thankful to ma'am Prachi. I am
Yep.
very grateful to you. It is a very good source of knowledge. Thank you again.
Thank you
Thank
so
you.
much, Hamza. Thank you so much for your kind words. Let's move on to Yogita Sharma. Yogita, your question, please.
Hello,
Hello.
good evening, ma'am.
Good evening.
Ma'am, I wanted to know about Express FLYR pathway as a physio from UK.
Okay. So have you done your BPT in UK, from UK?
Actually, I'm from India, but for some
Mm-hmm.
reason I can't move directly to Australia right now. But I'm
Mm-hmm.
planning my masters in UK.
Mm-hmm.
But for a long run, I wanted to settle in Australia.
Mm-hmm.
So
So are
for
you an
that,
HCPC registered person?
no, I'm just now planning
So
right
you
now
have to be first a
for
registered
masters.
physiotherapist. No, so you have to be a registered physiotherapist over there in UK, Yogita, and only
Okay,
then you can, go and get your license in Australia after that. Okay?
okay.
Okay.
Thank you.
Thank you. Next, QT Pi, your question, please. Okay, you have some other name probably. Can I get your question? Okay, a person with this name, QT Pi. Can I get your question? No? Okay. Keshvi, I have been calling you. Where were you? Please ask your question. Sorry.
Good evening, ma'am.
Good evening.
Ma'am, I am audible.
Yes, you're audible.
Okay. Ma'am, my question is IMB form 4th year with executive student. What is the correct pathway for me? I want to a government job.
Okay. So this is a webinar for physiotherapists, Keshvi. Okay, you are a B Farm graduate. You can apply for different kinds of jobs and opportunity. There's a channel called Family by Academically on YouTube. Go search that. Okay, and a lot of job postings and a lot of videos have been posted for the pharmacist government jobs. You can follow there. You can get your answer. Okay.
Thank you, ma'am.
Thank you, Keshvi. Next is Shumela. Shumela, your question, please. Shumela, your question, please.
Yeah, hello.
Hello.
Yeah, good evening.
Good evening.
So I'm currently in Australia, like pursuing Masters in Health Administration in Brisbane. So my question is like, after that, can you please guide me, like what will be the like good stream to go? Like you already said, in clinical assessment, you will be asking 2 to 3 cases, uh, two short cases and one long case. So will
Three
it be
short
like
questions, one long case.
yeah, multiple choice question, or like they'll give us a case and we need to do open exam, like
Okay.
we can search
So
everything.
basically, Shumela, if you talk about written exam, in written
Mm,
exam, there's nothing of sort of open exam sort of.
yeah,
Okay.
yeah.
Number one is your MCQ. So you will be given 15 case scenarios in the first half for 2 hours. And in one case scenario, you'll be having 4 sub questions with MCQs. Okay.
So
If you
that is
talk
for
about
written
the
exam.
Viva, that's a written exam. If you
Okay.
talk about the capability assessment, which is your Viva, okay, now in that you have 1.5 hours of interaction with the registered Australian physiotherapist. Okay, now basically in the starting you have 10 minutes of introduction. Okay, you have to give your introduction to the person who is sitting in front of you. Okay, after that you will be given 3 short cases. That person will be giving you 3 short cases, and you'll be having an interaction of 45 minutes with him for your answers and everything. After that, you have a break of 15 minutes, after which you get a reading time of 15 minutes, wherein you can open up your books and notes, whatever is there. And after that, he'll be asking you one long case. He'll be giving you one long case. You have to answer that particular case within 35 minutes. So it's basically of 2 hours, wherein at least 1.5 hours is the interaction time. Okay.
So within that period, in one long case, I can open my book and search, or
Yes.
within
After three
15
short
minutes, I need in break itself, I need to search everything.
Yes. So after 3 short cases, you'll be getting a reading time of 15 to 20 minutes. You have to read or search whatever at that particular time. And after that, they'll ask you a long question. Okay. There's one video of ours on YouTube. You can go check that out. We've explained about the cases and everything, whatever kind of questions are asked, and you can understand.
YouTube link, can you please give me so that I can?
Yes, it will be given down to you on the
Oh,
chat
okay,
box.
okay.
Okay.
And one more thing,
Yes.
which stream will be like high demanding after the completion of the clinical assessment, like sports, rehab, or age?
Okay. Prachi ma'am will answer.
So see, because I'm not sure which country you are completing your graduation.
No, I'm currently in Australia, in Brisbane,
Yeah, but which country you have completed your graduation?
from India itself.
Okay, so see, which whoever country which where you're from, we complete the graduation, they consider it as a fresh grad. Even if you do masters or PhD, they consider us as a fresh grad. So from there, you have to make a choice. Where would you like to go? And from there, even if you have 5 years of experience, you will be again considered as a grade 1 graduate. So you can apply for hospital, you can apply in hospital, or you can apply in aged care or clinic. That will be like a fresh grad, nothing like you have completed masters in India or you have done PhD, so you can straight away go to sports or hospital. It's nothing. It all depends on the vacancy, your interview, and your experience. So if there is a grade 1 physio post open, you can apply. If you get cleared in the exam, in the interview, then yes, you will be they will take you. So it is like that. It's nothing that which one is. Of course, if you have your own clinic or in the sports, you will get more money, but they will also check onto the experience. So on Seek, you can see there is the requirements. So they will send you the requirements, and if you fit into their requirements, then they will invite you for the interview.
Okay. And one more thing, for the after the interim certificate, we can apply for the as a job there, like after interim
Um,
certificate. I heard that like many people have
After
been
interim, you can apply for limited registration physio as a limited registration physio job if it is available, and if any company has or any agency has the requirements.
Will I need like experience for that?
No, it's like if the company or if any agency, they require limited registration physio and they are happy to supervise you, then they will offer you a job. But it all depends on the requirements that time. You don't need to have any experience. They will be giving you an induction. They will give you a supervisor where you have to report. They will give you a site for work, but it all depends on the availability.
Okay. Okay.
Thank you,
Thank you so much,
Shumaila.
sir. Thank you so
Thank you
much.
so much for your question. Next, let's move on to Kaushal. Kaushal, your question.
Hello, good evening, ma'am.
Good evening.
I have completed my Bachelor of Physiotherapy from India, and also I'm HCPC registered physio. But currently I'm in India due to some personal reason. I can't go to UK. So can you tell me which pathway should I follow for HCPC through Australia physiotherapy practice?
No, so basically you have to go for APC, Kaushal. Okay, or you can move or get registered in New Zealand and you can work there in New Zealand if you want. Work for 2 years in New Zealand and then move to Australia. But if you want to really go to Australia, you should go for APC because you have done your BPT from India, right? You are a
Yes,
UK registered, but you have got your registration in UK. So that's a different
yes.
scope. Yeah. So I think APC would be the best option for you.
Means APC registration for HCPC registered physio, right?
No, 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 no. For that, see, basically that there's a loop over there. Okay. If you have done your BPT from UK or London or not, you've done it from India, right?
Yes.
Yes. So that is why, and you're not a UK citizen or something like that. So you should go for APC process, the written exam process, the proper process of APC. Otherwise, if you
Okay. And
want to take
after
the
that,
advantage of UK or registration, you can get yourself registered to the New Zealand Council. Okay. You can transfer registration to New Zealand, get the express registration in New Zealand, work there for 2 years, and then get your license transferred to Australia.
okay.
Okay. Thank you.
Can you give me briefly details about this? Any link or any YouTube video or?
The counselors will be connecting with you after the webinar by tomorrow. They'll be explaining everything to you in detail. Okay.
Okay, okay. Thank
Okay.
you so much.
Thank you. Let's move on to AJ. AJ, your question, please.
Hello, ma'am.
Hello.
Can you hear me?
Yeah, we can.
So I recently graduated from India, bachelor's degree. So which is the best way to get to Australia?
The APC pathway, as Prachi ma'am has told, the same answer.
If I'm doing masters in Australia, there will be any bypassing this exams and all in any university and all.
Ma'am will answer.
Okay, so Amit, yeah, just we have answered this question before. Yeah, so there are some university, but yes, you have to find out if those university is giving you AHPRA registration, because some of the university, they give master's degree, but they do not give AHPRA. So if you are doing 3 years or 2 years of master, and if you are not getting AHPRA registration, so it will be very hard for you to apply for the visa. So for the visa purpose, you need the AHPRA registration. So if you want to go for uni, yes, you can do 3 years or 2 years of masters or whatever is the masters, but then you have to think about whether you want to do the masters, study, time, money, because it will be on a foreign student fee. While if you want to go for the APC, it is once you clear your English test, you can straight away apply for the APC exam, and the exam can be done, as quick as in 6 months time based on your preparation. So I think 6 months is much easier to do, and sitting at home doing all the exam and getting the preparation than doing the masters of 1 or 2 years, because getting into the masters again, there are entries either in the January or in the September, the waiting period and all that stuff. So altogether 2.5 years or 3 years of masters, and then the money. So depend which way you would like to go. At the end of the day, everybody wants to get the residency and visa purpose. So think in that way as well.
So you are telling me going as working will be much better option.
um it all depends on what you want. If you want to study, if you want to increase your get your clinical knowledge, or uplift your skills, you can go for masters. But yes, some of the masters you need, they do not provide the AHPRA registration, or they would not give any certification during the visa purpose. So what is your goal? You want to achieve your AHPRA registration along with your citizenship, or you just want to study and come back? So based on your goal, you can think about. If you do the APC process, this process will give you the registration in quick time, plus you can apply for visa purpose, and then you can get you can get the residency.
Okay.
But if you
Okay.
go through the masters, they may or may not, so you need to
Mhm.
check the university in advance.
Yes.
Also, ma'am, currently working as a physiotherapist in a reputed hospital. So, is it useful for abroad, especially Australia and
To be honest with you, as I mentioned, no matter whatever qualification you come with, they consider you as a grade 1 physio. So you have to start from as a fresh. Yes, your experience can help in cracking the interview, but once you start here, they consider the Australian experience. So you can give interview for the hospital openings, but as you do not have Australian experience, they will consider you as a grade 1. That means a fresh grad.
Thank you, AJ. Let's move on to Amit. Amit, your question? Amit Kushwaha?
No,
Okay.
ma'am.
Okay, thank you. Next, Sharjeel, your question. Was anything left, Sharjeel? You had asked? No.
Yes, I want to ask, I am a freshly graduate physiotherapist from Pakistan, and I have completed my house job of 6 months and now running a small setup. So, ma'am Prachi, what do you think? Should I go for exam or get some more experience before sitting an exam?
How many years of experience you have?
8 months.
8 months. Okay, doesn't matter. If in fact those who are like fresh grad, their knowledge is much fresh. I think it's very easy for them to clear the exam. I would suggest that at least start preparation for your written exam, and start giving the written
Yeah, I
exam.
am planning for
Once
March attempt for March.
so March, you still have time, and you have recently cleared your exam, your graduation. So I think things will be very fresh. Um, Focus on APC, whatever the book, the reference book and all they have given. Read them. Focus on the clinical case scenarios and all, and I think everything will be good. Yeah, better. Yeah, better the
So then,
sooner.
just after a clinical workshop, when we will get our final certificate or after registration, how much time is required? What is the process? Can you share?
As Sonal ma'am has said, once you clear your written exam, there will be a capability assessment, that is sort of a viva. So it all depends on how many candidates are there, and the timing. But usually, because it is online, it should take a faster. So maybe if after your written exam, if you have immediately applied for your clinical capability, might be within 1 or 2 months things will be sorted. If you clear that exam within couple of weeks time, you will get your um, outcome, and once it is done, then you can apply for the workshop. So the workshop again, maybe 1 or 2 months of waiting period. So total of, I think, 6 to 7 months or 8 months, things should be sorted if you do everything on the spot.
Okay. After written exam, can we apply for a job or we have to wait for a clinical workshop to have to pass it?
um there are some opportunities which is called limited registration physio. You can apply, but yes, these days there are the companies also check if the person is in Australia, have the PR. If you have a PR, if you are in Australia, then they can give you supervisor and you can work. But if you are not in Australia, so the chances are a bit sleek, because they have to sponsor your visa and all. So it takes a bit of long time, like 6 to 7 months time, for example. If it's taking, then the company will opt for someone who is in Australia. So I would suggest focus on your written exam, but yes, apply for the job as well. There might be the opportunity, so grab it, and then you can give your other second part of the exam. But if you feel that okay, the opportunities are not there, so don't stop here, just focus on your capability exam as well.
Yeah, but just I want to know about the clinical workshop in Melbourne. We have to
Okay,
wait
so
for a.
Shajil, I will just, because you have so many questions and the other people are waiting,
Okay, okay,
the counselors will connect with you over a one-on-one online video conferencing. Okay, you can ask
okay.
your
Thank you,
questions
ma'am.
freely over there. Okay,
Okay.
thank you so much, Shajil. Next, let's move on to Garima. Garima, your question?
Hello, ma'am.
Hello.
I am currently studying my master's in UK. So, what is a good idea? Given APC exam directly or register with HCPC and gain experience of UK and then go to Australia because I want to settle in Australia.
Okay. So, as of now, because you're doing your MPT there in UK, okay, you can apply for your HCPC registration also side by side, Garima, because if you have to be a BPT graduate for that, so you will be getting your as registration as well. But also side by side, you should prepare for APC. But if you are saying you have to go and rest and you have to settle in Australia, APC is the best method, definitely for you. Okay,
Okay,
along
ma'am.
with the
So,
BPT, you can go.
if I have HCPC registration in UK, can I get direct entry to Australia or I have to given the APC exam?
For Australia, direct entry, definitely, as ma'am was also saying, APC is the best pathway for you to go. Okay, because see, the company or the ma'am, I think the employers are also seeing that if there's a shortcut pathway, they would choose somebody who has gone through the entire clinical process over somebody who has taken a shortcut pathway.
Yes,
Correct?
you see the one, like I think few months ago they were taking, but the rules have changed. I think you can check from the website. Earlier, like maybe 5 or 6 months ago, they were taking people from HCPC, but nowadays they are asking for 2 years of experience in UK or New Zealand.
New
So if
Zealand.
you have UK, New Zealand, then only they are taking for Australian certification. Plus, the thing is, if you want to apply for visa, if you want to be a primary applicant, then during the visa purpose, again, there will be an issue. So unless and until you have an APC certificate from the APC pathway, the visa may not be granted. So that's the safest thing, is to get APC done and get the visa, because some of the HCPC, like, because I have some friends who have like they are here and they were working here since long, and they were from HCPC pathway, and their visa, they couldn't apply for the visa now. They are going again in the APC, because even if they are in Australia since 5-6 years, but they are again for the visa purpose only. So then it is like, again going to the same process. It's better to do one process and, clear both the things, rather than getting the job from HCPC and then again clearing the APC for the visa purpose.
Yes.
Okay, ma'am. So if I have to given the APC assessment, so there is need to give the IELTS exam also.
Yes, IELTS, PT or OET, any one of the three. Okay.
Okay, ma'am.
Yeah. Thank you,
Thank you,
Garima.
ma'am.
Next, let's move on. Last question from Shumaila. Shumaila, your question, please.
For PT, how much band is necessary?
For IELTS, you need 7. For PT, 66.
66.
Yeah.
So before the documentation, we need to write PT or like
You can
during
give
the
it after
written.
a written exam also.
Okay, okay, okay.
Okay.
Thank you.
You're
Okay.
welcome. Okay, so I think no more questions. We are done. Akram sir, can we end the meeting? I think no more questions left.
Yes, Dr. Sonal.
Okay. Thank you so much, Akram sir, for joining. Thank you so much, Prachi ma'am. It was indeed a very, very good and informative masterclass from your side for SIS. It's late over there in Australia, and I know that you have worked hard a lot in preparing for the masterclass. Thank you so much for such a good collaboration. And we will be ending with this webinar. Yes, Prachi ma'am.
Thank you.
Thank you so much, ma'am. Thank you so much, guys, for such an interactive webinar. We'll be meeting you again in yet another webinar with yet another bunch of healthcare professionals. Thank you so much for joining Academy.